Second, on the lockdowns at Kwai Chung Estate, what is your response to reports and online posts on complaints from residents there about the lockdown, saying that there are overfilled bins, garbage piling up, and poor meals arrangements? What is the threshold for extending or imposing new lockdowns in the estate? And lastly, you mentioned possibly expanding the vaccine bubble and keeping social distancing rules. So given the current COVID-19 situation in Hong Kong and calls from experts to ask people to wear 2 masks for further protection, why do you still choose to not wear a face mask during this session? Thank you.
The second question about the Kwai Chung case. Now, there is no doubt that we have a major spread in the Kwai Chung estate based on the Omicron variant, which is highly transmissible. And by now, on a cumulative basis, we already have 220 plus confirmed or preliminary positive cases in the Kwai Chung estate. But of course, again, in the same way that I described the 15 officials, if you look at these 220 plus cases spread over the 16 blocks in the Kwai Chung estate, they vary significantly. The Yat Kwai Lau clearly is the core of all these infections with a large number of cases. So having a look at the situation from an epidemiological perspective, and the mere fact that yesterday we still discovered new cases in Yat Kwai Lau, and they are not isolated cases. I think the figure is over 20 such cases emerging in Yat Kwai Lau. And that's why, to play safe, protecting the residents as well as preventing the spread of this virus, we have no choice but to extend the RTD, that is the restricted testing declaration, for another 2 days. That is from 5 days to a total of 7 days. I fully understand the impact on the residents, and there are over 2,500 residents alone in the Yat Kwai building. We will continue to step up our staff mobilization to provide support to the residents. Now, including the Ha Kwai Lau that I announced this morning, we will have 3 blocks of residents totaling over 7,000 people who need to be supported in the next few days in terms of their breakfast, lunch, dinners, and all their daily necessities, their requirement for drugs, and so on. I would not say that we have done it in a perfect manner, but we'll continue to improve. I already said that we will improve in terms of the hotline inquiry, we will improve in terms of cleaning the rubbish and distributing the mailboxes, and also arranging in an orderly manner for the residents to undergo the compulsory testing. As far as the vaccine bubble, let me put it that way. There is no doubt that vaccination remains the most effective way in order to tackle the virus, including Omicron. And unfortunately, in Hong Kong, we have been doing vaccination for almost a year. We started in February last year, so it's almost 1 year. Our vaccination rate still lags behind places in our vicinity, in the mainland, in Singapore, and other places. So we really need to jack up the vaccination rates, especially amongst the elderly. They have been very cooperative. We are seeing the rates coming up, but still, it's not yet reached a stage that we feel safe. Because you could imagine that one of the primary objectives of our anti-epidemic work is to protect our public health system, is to protect Hong Kong's public hospitals. So if an elderly gets infected because, for example, just for argument's sake, a care worker living in Yat Kwai Lau was serving this elderly in an elderly home, and the elderly get infected and spread to other elderly, and all of them have to be admitted into hospital. And they will have to stay pretty long in the hospital because of their preconditions, or even die in the hospital. That would be a major load on Hong Kong's public hospitals. And the last thing we want to see is a collapse of the Hong Kong public hospital system, as we have seen in some other places. So we are finding and exploring all ways to enhance the use of, to enhance the creation of all this vaccine bubble, in other words, to impose vaccination as a requirement for entry into the prescribed premises or joining certain activities. Now, finally, it's a very personal question, but I welcome this opportunity for me to explain once and for all why I'm not wearing a mask on this occasion. This is not incidental. This is a well-thought-out behavior of the chief executive. I stopped wearing face masks on 2 occasions when I speak to the media and through the media to the people of Hong Kong. One is in the Legislative Council chamber, whether when I was delivering my policy address, when I went in to answer questions and so on. The other is standing here in the auditorium talking to you people and through you, because every time I come out is televised, to the people of Hong Kong. The people of Hong Kong have to hear very clearly from the chief executive what are the messages that she is conveying to the public. The people of Hong Kong may even have to feel my emotions. So sometimes I am pretty relaxed. For example, in August last year, the virus situation was well under control and our athletes were doing so well. I came here to talk to you in a very relaxed and very elated mood. But now I'm very somber. I'm very solemn because I'm very worried. And wearing the mask would not allow people to see for themselves the chief of the chief exec or the chief of the Hong Kong SAR. I'm the chief executive of the Hong Kong SAR. People need to understand and feel my feeling. Now I'm very worried. And so I'm not going to smile to you very relaxed or in a very casual manner. This is a very solemn occasion. So I'm not doing it because of discomfort. I'm not taking off masks because of discomfort, because if you see me on the street, I'm wearing my mask. If I do my 3-day presentation of what's an honest, 6 hours a day, I wore my mask. But now I'm talking to the people of Hong Kong. And I want the people of Hong Kong to understand exactly the situation that Hong Kong is in and to pull in their efforts to support this very important fight against the Omicron. So I hope I answer once and for all. This is nothing of personal. This is really performing my duty as the chief executive of the Hong Kong Special Administrative Region. Now, I'm coming to the end of this media stand-up. As I said, this is the last occasion before the Chinese New Year. I wish you all a relaxed and peaceful Chinese New Year, but you will see me before you break off for the Chinese New Year holiday. 多謝大家。
今日嘅記者會今日到此為止，唔該晒大家。